So quickly, we want to look at some guidelines, okay, that will guide you in taking history for obstetrics and gynecology issues. So a patient comes to the hospital and gynecological complaint. So history taking is like you are trying to ask the patient some one or two questions to get some one or two answers from them. Do you understand? So that it can help you work towards a diagnosis. Okay. So the order, that's like you should do this thing one after the other. Do you understand? It will actually help you more to capture all what is needed. So taking a thorough history in obstetrics and gynecology is essential. It will help you to be able to pinpoint what is wrong with the woman. It will guide you on what type of treatments to initiate. Then it will also help you, it will help the patient kind of like you more because you attended to them in a professional way. So first, you have to take note of the patient identification and demographics. So name, age, marital status, occupation, educational levels, address, contact details, all should be captured in your history taking. Presenting complaint, like what actually brought the patient to the hospital today. All right. So sometimes the patient might actually want to deviate, but you can guide them back so that you can try to get the presenting complaint. The history of presenting complaints. How long has it been there? How does it actually show up? What are the things that make it show up? Do you understand all those kind of things? So you are checking a history around that complaint that actually brought the patient to the hospital that day. The menstrual history, very important because you are dealing with women problem. So you might actually want to know how, the age at which they began menstruating, all right, how their menstruation cycle goes, like the last time they had menstruation, all right. And you ask them that apart from the menstruation, do they actually bleed outside their menstrual time and all of that. Then we take obstetric history, how many times she has given birth, how many babies she has born that they are still alive, how many babies she lost due to miscarriage and all of that. Okay. Then also mode of delivery, how does she actually deliver, the complications that could come up and all. Then gynecological history, look at things like vaginal bleeding, discharge. Yeah. Does she has itching? Has she ever had sexually transmitted infections? Yeah, medical and surgery history too. You now combine. Does she have any other disease condition in any system? They also ask like, okay, has she ever had any surgeries? Then you also ask about surgeries in the gynecology, in the genitourinary region. Okay. Then you also ask if they have ever done any tests, like taking any samples from the vagina or anything. You understand? Then drugs and allergy history. This will guide you to know the type of drugs that the patient will want and not want. The family history. You ask if there is any chronic disease condition running in the family. Then on the women's side, you also ask if maybe her mother, the sisters, her real sisters, do they have any issue similar to this, right? The social history. Does she smoke? Does she abuse alcohol? Does she use substance? Okay. So that's just it. Okay. Step by step. These are the things that you should follow, numbered accordingly. Right, when you're taking history in obstetrics and gynecology.